Hi, I'm Dr. Paul Petrangero, the Clinical Director at Smiling Dental Implant Centers. We're going to review our patient Murial and her patient story that she gives us a wonderful testimonial of. And I want to spend a couple minutes just talking about what her problems were and what I had to do to rectify them. When I first met Murial, I was brought into a large all-on-4 center in the Chicagoland area that has multiple offices. And some of the problems with these centers is the lack of continuity of care from multiple providers. So when I first saw Murial, she had a surgical complication of having implants put into her nose, 4 to be exact, and then she had also issues in her posterior sinus regions where she would drink some water and it would come out of her nose. This was very, very discomforting to Murial. She had seen multiple doctors within the clinic. They had attempted to do a couple procedures to rectify her drinking the water and coming out of her nose. All of them were unsuccessful. And then when I met Murial, I outlined a treatment plan for her that would take several steps to correct her problems, but then rebuild her so that she could enjoy her dentition, and that's exactly what we did. Our first procedure was to rectify the problems with her sinus, removal of the implants into the nose, and take care of any nasal damage that was present, followed by subsequent grafting procedures and then placement of implants into the upper jaw. We had to do a couple of the zygoma implants for Murial based on her bone loss that she had suffered from the first procedure. And her case was then completed with an upper beautiful, what we say is monolithic zirconia case, which is a very highly aesthetic restoration on the implants that were placed in her lower all-on-4 dentition, which was also completed by our clinic. And she is a wonderful woman. She's very thrilled that her problems were finally rectified. We were able to get those all under control for her so she can go on and live her normal life. Thank you.